Good afternoon, everyone. I'm Karen Ruprecht with the State Capacity Building Center, and thank you for being with us today for our Ask Me Anything session on posting serious incident data in child care inspection reports. This webinar is part of a larger consumer education webinar series hosted by the State Capacity Center, and this one is our very first Ask Me Anything session, so welcome. Today we're going to walk through some questions that participants posed on the national webinar that we had on this topic exactly 2 weeks ago today. We know you may have some additional questions as we go along, so we encourage you to use the chat feature and put your questions in the chat box. We've also included the PowerPoint slides from the webinar from 2 weeks ago that's in the download pod that you can see on your screen. So we encourage you to download that PowerPoint because there may be some questions that you have that the PowerPoint slides from 2 weeks ago may answer. So let's get started with some introductions. As I mentioned, I'm Karen Ruprecht with the State Capacity Building Center. I'm a Managing Director of Early Childhood Systems, and I work a lot on consumer education topics.
And I'm Nina Johnson with the National Center on Early Childhood Quality Assurance and the State Capacity Building Center.
Thanks, Nina. And before we get started, we wanted to learn a little bit more about you. And we have a quick poll for you to take that Violetta's going to pull up for us. Thank you, Violetta. And we'd like you to select a role that fits you best, whether you're a community member, part of state government, or a training and technical assistance professional. So we'll give you a moment to do that. So it looks like we have a majority of state government professionals here today, along with some training and technical assistance professionals, and we have someone representing the vendor community as well. So welcome, everyone. Thank you for completing that poll. It's always good, as I'm sure many of you on the call today have done training or technical assistance before. It's good to know who's in the room and who's in your audience. So now we'd like to go ahead and if we could flip back to the slide, thank you. And we're going to get started on some of the questions that were posed in the session 2 weeks ago. So Nina, I'm going to start with a question with you. We know there are various requirements pertaining to serious incidents. So can you help tell us what is the difference between the aggregate data reporting requirement and the inspection report requirement that's related to serious incidents?
Yeah, Karen, it can be confusing. The inspection reports are required for each licensed provider and each non-relative CCDF eligible provider. In contrast, the aggregate data report does not list individual provider-specific information or names, but it must be organized by category of care and licensing status for all eligible CCDF provider categories. The inspection report requirement specifies that any health and safety violations, including any fatalities and serious injuries occurring at the provider, must be prominently displayed on the report or summary. However, all deaths and serious injuries, regardless of cause, are required to be reported as part of the aggregate data reporting requirements. I hope that clears things up a little bit.
Thanks, Dina. I think it does clear things up a bit. And again, if you do have questions or continue to have questions about that, we do encourage you to put your question in the chat box. So Nina, if I'm working on the aggregate data reporting and I'm trying to find out how to post it on my website, what kind of resources do we have to help states and territories do that?
Well, you're in luck because hot off the presses is an annual aggregate data template. So this is a screenshot of the cover of the template, and then this is a screenshot of a table from that template. And it provides an option for displaying aggregate data on serious injuries, deaths, and instances of substantiated abuse. So I'll stress again that what this provides is just an option for displaying this information. It also contains additional information like definitions of terms that would help provide some context to families or others who are using this information. And we'll send the registrants of this webinar a link to this template.
Great, thanks, Nina. And just to reaffirm that you will receive a link to download this template so you can use it in your individual states and territories. But if you could give us a little preview of some additional information in here, Nina, are there any quality assurance tips that you can give when states are posting aggregate data?
Yeah, this document has some tips. Karen, you're right. One that I think is really important, though, is to make sure that the data are pulled on the same date to ensure consistency. And this allows you to compare data across years and helps you identify trends and opportunities for professional development based on that data that you've gathered.
Great. Thank you, Nina. So now I want to move into some questions around inspection reports. So can you help explain what a full inspection report entails?
Sure. A full inspection report covers everything in the monitoring visit, including areas of compliance and noncompliance. Families, the public, and providers need to have access to information about what was included in a monitoring visit, not just the areas of noncompliance. And this information includes the dates of the child care provider's most recent health, safety, and fire inspections, and the results of monitoring and inspection reports for all eligible and licensed child care providers other than relatives, including those due to major substantiated complaints about failure to comply with provisions. So if you don't produce any reports that include areas of compliance, there is some flexibility. However, your consumer education website must include information about all areas covered by a monitoring visit. So for example, Karen, people could post, as we mentioned before, they could post a blank checklist used by monitors. But as a reminder, you must use plain language that families and child care providers understand. If the full reports are not in plain language, you need to post a plain language summary or interpretation in addition to the full monitoring and inspection report.
Thanks, Nina. That's really helpful to hear. I still have a couple of follow-up questions about inspection reports I'd like to ask you that our participants raised a couple of weeks ago. The CCDF regulation says that states and territories should ensure that these reports are in plain language. Can you explain to us what does that mean and what that might look like?
Yeah, I can help explain that. Plain language is required for the monitoring and inspection report so that families and other stakeholders can understand the information that's contained in the reports. Terms or acronyms that are familiar to us, as you know, in the early childhood field, are not necessarily terms that families understand. So it's important when information is posted that it's written in a way that families can understand. In other words, we want to be as jargon-free as possible.
Okay, so can you give us an example of what this plain language would look like? For me, I know I do a lot of writing, but how can I be sure that I'm writing so that families and others who aren't in our field of early childhood can understand what I'm saying?
Yeah, of course. Some of you may have seen these before. These 5 steps to plain language were taken from PlainLanguage.gov, and I think they provide some helpful guidance. So number 1, describe your target audience. So know who your audience is and be sure to write for your audience and not for yourself. And in this case, since the target audience for inspection reports is families, you can design your content accordingly to meet their needs. Number 2, structure the content to facilitate a reader's understanding. This means organize the information using things like headings and bulleted lists. So you can see here that using plain language is more than just the language and the words that you're using, it's how you're organizing the information. Number 3, write in plain language. This is what we typically think about when we think about plain language. So in this case, you want to choose your words carefully, you want to be concise, and you want to keep it conversational. So you could use an active voice and remember that you're writing for an audience of 1. Number 4, use design features to facilitate understanding. Design for reading and consider visuals and organize information in tables if it makes sense. And follow web standards. For example, write effective links and avoid too many PDFs. And then finally, number 5, Work with your audience to test and inform the design and content. This is where you get to find users, like parents, and get their feedback on your content and then make adjustments accordingly. And I think it's a good idea to keep doing this. So once you're done, it's a good idea to keep evaluating your website. And now I'm going to walk through an example of what plain language looks like. So just take a few seconds to scan these two examples. You can see that by using plain language, the second example takes up half as much space. And this is important because space and time are valuable. The second example uses second person rather than third person perspective. It only includes the necessary information. It uses concise and understandable words, and it uses an active voice. And I know that it can be a challenge to use plain language when you're dealing with regulations, and that's why a plain language summary is often helpful. Some states train their licensors to write in plain language, and some automate the use of plain language through autofill features on mobile monitoring software, which also helps with consistency.
So if I could summarize a little bit of this, Nina, plain language is about making information accessible for your audience. In this case, for families, since we're talking about inspection reports, it's about clear communication and using common words and presenting information in a straightforward, logical way. And, you know, when you think about that, that makes a lot of sense for a consumer education website that's geared towards families. And I can see how writing in plain language can help families understand the inspection reports better. Thanks for these tips, Nina. But I'm also curious about what other resources are available for states and territories to meet this plain language requirement.
I love the resources that are available on the PlainLanguage.gov website. It walks you through these steps in more detail that we went over, these 5 steps, and it includes a lot of really good examples.
Great. Thanks, Nina. This helps a lot. And for those of you on the line, if you're not familiar with PlainLanguage.gov, I highly suggest you bookmark this site and share it out with others. This is great not only for consumer education websites, but across all agencies and organizations, so that the information that we present to families can be in an accessible language that they can understand and readily understand our information. So now that we've talked a little bit about plain language, Nina, can you show us some examples of inspection reports that use plain language?
Sure. So this one may look familiar to you. And also remember that a full report covers everything in the monitoring visit, including areas of compliance and non-compliance. In this example from Idaho, all elements of a health and safety inspection with icons that describe the element in plain language are included. And it also indicates if the program met each criterion and provides a description of the corrective action if it wasn't met. And then in this next example from Ohio, you can see Ohio includes a link that takes you directly to the full report, as well as a plain language summary that includes non-compliances only. So Karen, there are several ways that you can include a full inspection report on your website, and these exemplify a couple of those.
Great. Thank you, Nita. But how about if a child care program is on a corrective action due to a non-compliance? Do those plans have to be displayed, or just how the provider has corrected the deficiency? Do you have some examples of that?
Yeah, this is an example from Oklahoma, where they list a plain language summary of non-compliances observed during each visit and the associated corrective action plans. The CCDF regulations require posting information on corrective action taken by the state and child care provider where applicable. And this information should include a description of the non-compliance item. So for example, failure to have an updated vaccination record on file, the corrective action taken by the state and child care provider where applicable. For example, program staff will contact the family to obtain an updated vaccination record and ensure it is on file, and how it was corrected. For example, program staff contacted the family to obtain an updated vaccination record, which is now on file. And then when it was corrected is optional.
Great. Thank you for showing us those examples and walking us through those examples. I have a few more questions that were posed to us by participants in the webinar 2 weeks ago around inspection reports. So I'm going to ask those to you now. So what if a state uses paperless or mobile monitoring? What can they post instead of a blank checklist?
Well, the short answer is that they can post anything that includes all of the standards included in the inspection report. If paperless or mobile monitoring is used, states likely provide the program with a written or electronic copy of the full report, including any findings. And perhaps this report that is shared with providers could be posted on the website. The state could summarize all criteria reviewed during an inspection through such formats as a checklist or a table. If the state provides a plain language summary of noncompliance, it would be helpful for the state to include a note on their website saying something along the lines of, this is a summary of inspection criteria found to be in noncompliance. A complete list of all criteria reviewed during an inspection may be viewed here with a link to that criteria. I hope that helps.
Great. Yeah, I think that does help out a lot. We also have some questions, and I know some states and territories are probably thinking about this as well, but what should states or territories do if their current inspection reports contain personally identifiable information?
Yeah, that's a really good question, and I know it's something that's come up a lot. Section 98.15 of the CCDF regulations requires states to have in effect policies to govern the use and disclosure of confidential and personally identifiable information about children, families, and child care providers. And Karen, from here on out, when I talk about personally identifiable information, I'll refer to it as PII for short. So when making information public, you should ensure that the privacy of individual caregivers and children is maintained and consistent with state, local, and tribal laws. For example, states with concerns regarding providers' privacy, and particularly family child care providers that are providing care in their homes, could use a unique identifier like a licensing number to include on the provider's profile. And then families interested in a certain provider can ask the provider or the child care lead agency for the identifier to look up more information about health and safety requirements met by that provider on the state's consumer education website. You may have specific laws, policies, and guidelines about including potential PII within posted inspection reports, and really it's best practice not to include PII within the posted inspection reports.
Thanks, Nina. That does help, but what if I am working in a state or a territory and some of our inspection reports do have PII on it? What should we do?
Yeah, it's a good question again. There are different solutions that will work for different states. You may need to create a plan for addressing the reports that are currently posted and then another plan for addressing future reports. Licensors may be trained so that they're not capturing PII when completing reports that will be posted. If posted inspection reports currently include PII, it's recommended that the state or territory work in phases to address the issue in both the short term and the long term. So you may want to redact the PII from current or past reports if possible, and then consider reformatting future inspection reports to facilitate posting. This includes designing an inspection report format that ensures PII is not captured and that reports are written in plain language. Additional continuous quality improvement activities might also include training for licensors to ensure that PII is not captured when completing reports that will be posted online.
Great. Thanks, Nina. So another question that we were asked is there a list of states or territories that are in full compliance with the requirements for posting inspection reports and aggregate data?
There isn't a list currently available, OCC will be posting a list of states that have met or not met the requirements included in the CCDF state plan, and when available, this list will be posted on the OCC website.
Great. Thank you, Nina. And thank you so much for providing us with guidance on aggregate data and inspection reports. I'd like to remind everyone that we will be posting the aggregate data template, and Nina and I's exchange our back and forth questions and answers on the Child Care Technical Assistance website, and we will be emailing you a link to that template very soon. Before we do some of our parting slides here, we do have a couple of polls that we'd like to share with you. And this next one, because as I mentioned at the beginning of this session, this is the first time that we've done an Ask Me Anything webinar. So we'd like to get an idea from you about how helpful this has been. So we have kind of a quick 3 questions to ask you, if this has been a helpful format, if your questions were answered, and if you have remaining questions. And if you do have remaining questions, please put them into the chat box so we can get to them. I know as Nina and I have been going back and forth, I see some of my colleagues have been trying to help some of you out, and we will continue to do so after this webinar as well. We will take questions that you've posed and try to find answers to them and post them on the website, and we will send that as well to you at the conclusion of this webinar. We have a couple of additional polls that we'd like to have you take, and these are some polls that help us really improve upon our webinars and our online learning. So how much of your understanding of this aggregate data and inspection reports improved today through these questions and answers? Again, this helps us improve our practices as we go on. We'll give you a couple, well, not a couple minutes, we'll give you half a second. How's that sound? To finish taking that poll. Okay, great. And then if we can move on to the next question is, how likely are you to use one of these strategies or practices moving forward? I know we put a lot of information forth with you guys today, and we will be following up with some resources. Sometimes having those written resources is helpful, as well as hearing this in a webinar format as well. Okay, and then our last poll question is, are there any other webinar topics that would be useful? We really do use this information at the State Capacity Building Center to make sure that we're providing webinars on topics that are most interest to you, working in the states or working as contractors in the states, things like that. So if you have any additional webinar topics that you think would be helpful for us, we would love to hear them. And then I'd like to remind everybody regarding the next webinar that we have in our series. As I shared at the beginning of this webinar, this is a series of consumer education webinars that we're hosting from now until the end of the year. So our next webinar it will be offered on May 9th from 2 to 3 o'clock Eastern Time, and this topic will be around making your website accessible to all families. We're really thrilled that we're going to be joined by our experts from the user experience team, and they will cover best practices in accessibility and translation. And we'd like to encourage you to invite people in your organization that might be responsible for the technical aspects of your website and designing the content of your consumer education website as well, because we'll be able to share some information that I think we'll find incredibly useful. As we mentioned, we'll post the questions and answers that Nina and I discussed today, along with other questions and the aggregate template. and we'll send you a link to the recording as well. So thank you all for joining us here today, and we hope this has been helpful, and please feel free to reach out if you have additional questions. Have a good day, everyone.